coverage on the president's coronavirus concerns continues now with our chief health editor, Dr. Nandi. Thank you, Dr. Nandi, for joining us on this Friday evening.
Oh, my pleasure. Thank you.
So, Doc, the White House revealing the president is receiving an experimental antibody cocktail. Please explain how this works.
Well, Linda, first of all, I'd like to wish both President Trump and the First Lady, a really speedy recovery. This is about our entire country, and I'm hoping for the country does very well and has a speedy recovery. I want to say that first. Now, back to the treatment. The treatment he's getting is called Regeneron's antibody cocktail, and it contains two antibodies, Linda, that are rolled into one treatment. The idea behind having two antibodies is that they'll hopefully work together, and then they'll bind and neutralize the virus so it doesn't replicate, so it doesn't multiply. Now, Regeneron recently released data from the ongoing trial, and the data suggests that this antibody cocktail can improve symptoms and also reduce the amount of time that a patient is sick. And best of all, the study found that patients like our president, whose immune system hasn't already built up immune response to the virus, has had the greatest improvements.
So, Dr. Nandi, the president is 74, but age not the only risk factor here that places him into that high-risk group, right?
100%, Glenn, and I'm concerned about the president's health. We know he has symptoms, and it's relatively early. He's 74 years old, as you mentioned. That's a risk factor, right? And we look at the data. It tells us that roughly 80% of folks who have died from COVID-19 are those who are 65 or older, and that's one concerning risk factor. There are two more. First of all, his weight and the fact that he's a man. Now, men in general are more likely to suffer from severe illness, and they're more likely to die than women. And as for his weight, from the reports that the White House has given us, he's unfortunately is mildly obese. And data shows that if you're obese, it can triple somebody's risk of being hospitalized. So those are risk factors that are concerning.
And honestly, Dr. Nandi, people have died also over this mask issue and the debate. And with the president getting infected, this really shows that the virus has zero boundaries. How important is it that we protect ourselves?
Oh my gosh, it's super important. And I'll tell you, if this didn't wake you up to let you know that you need to wear a mask, I don't know what else will. We know the president wasn't a fan, right, of masks, and he made some comments disparagingly about masks, but I can't stress enough how important masks are, irrespective of what anybody says out there, right? Face masks can trap droplets when a person talks, when a person coughs or sneezes. So it really cuts back on the stuff you put out there. It cuts back on how much virus gets out in the air. But also, face masks help lessen how much you'll breathe in. So my mask protects you, your mask protects me. So please wear a mask and continue social distancing, hand washing, and disinfecting. One thing I'll tell you really quickly is that the fact that the president's been taken to the hospital, I think that because he has symptoms, it's really smart, because this virus can turn very quickly, especially when he's getting symptoms early on. So they're watching him. If something goes untoward, they can get to him right away in one of the world's best hospitals. So I'm glad they've got him there, and they can get him better and do it quickly.
All right, Dr. Nandi, as always, we thank you for your expertise and, of course, a lot of well wishes for the president and the First Lady tonight.